For context, I think you all know St. Luke's oversees multiple hospital facilities across Southwest Idaho, extending from the Oregon border east to Twin Falls and then north up to Ketchum Stanley and north up to McCall-Riggins. Bottom line, our inpatient facilities are progressively becoming COVID hospitals, and that's the same story for the rest of the state. Some detail on that. We've gone from 33 COVID hospitalizations across our system in July to 289 today. That's at St. Luke's. COVID previously accounted for about 8% of our adult hospitalizations, and today it accounts for 67% with this single diagnosis. That's an unprecedented event in modern medicine. In our ICUs, the story is a bit worse. In July, we had 8 COVID ICU admissions across our facilities, and that accounted for 17% of our adult ICU hospitalizations. Today, we have 51 COVID ICU patients, and they account for 70% of our ICU patients. A few words now on what we're seeing with the patients that is significantly different from the December surge. And I wanted to highlight 5 things. First, they're younger. The age range of our adult patients today is 20 years to 85 years with a 2-week running average of 58 years. That's down from 72 years in the December surge. Of the 51 people with COVID in the ICU today, 36 are under the age of 55 and 13 are under the age of 40. We think this is probably in part due to maybe increased virulence of this Delta variant, but we mostly believe this is due to the higher rate of non-vaccination in this younger population. Which brings me to the second change in the pattern we're seeing. The patients are overwhelmingly unvaccinated. Now, this is similar to the December surge because we had no vaccine at that time. But what's new since the introduction of the vaccines is that we are mostly not seeing an entire segment of the population in our hospitals. The vaccinated, we're not seeing them. And we almost never see those individuals in our intensive care units. For some specifics, of our 289 hospitalized patients, 90% are unvaccinated. And of our ICU patients, 98% are unvaccinated. The ICU patients we do have who have been vaccinated are patients who are actively being treated for cancer with bone marrow toxic chemotherapy and patients with organ transplant on immunosuppression. The third difference, these patients are more sick. We're seeing increasing rates of mechanical ventilation, and that's at least in part because this younger cohort of patients tends to choose more aggressive care when they're hospitalized. If we're honest about it, 40-year-olds have not contemplated death before. For more specifics, amongst our ICU patients, of the 51 critically ill COVID adults, almost all of them are intubated and mechanically ventilated. And today we have a total of 64 ventilators running versus a typical value in a flu season for us in our health system of about 23. We're also seeing increasing rates of acute kidney injury, and we're continuing to see what we believe is an increasing rate of clotting events. And we've known about the association of COVID with clotting since the beginning of the pandemic, but we're seeing this now in younger patients: DVT, clots in the legs, clots in the lungs, pulmonary embolism, arterial clots in the heart attack, and in the brain, stroke. Fourth difference, these patients' length of stay in the ICU, if they survive, is longer versus what we saw in December. At that time, we had an average ICU length of stay of 6 days, and we're now sitting at about 8. And remember, this is average. The many patients who die often do so relatively early after ICU transfer, and on the other hand, we've got many patients who occupy an ICU room for more than 3 weeks. The final and really important difference is that these patients are dying more frequently. When compared with our winter surge, when our ICU mortality was around 28%, we're now seeing an ICU mortality rate of about 43%.